Now let's move on to our segment 3 of this chapter, which is about basic metabolic and endocrine assessments. Your doctor might look into metabolic and endocrine causes with these tests. So number 9 is thyroid function test. The purpose is to rule out thyroid function, which affects gut motility. Hypothyroidism, for example, can cause constipation. The thyroid gland plays a crucial role in regulating metabolism. Thyroid function, especially hypothyroidism, can slow down metabolism and gut motility, leading to constipation. So, thyroid function typically include thyroid stimulating hormone TSH levels and free thyroxine, free T4 levels. A blood sample will be taken to measure the levels of TSH and free T4. So, low TSH and high free T4 indicate hyperthyroidism, which is less common but can lead to rapid bowel movement or diarrhea, while high TSH and low free T4 hypothyroidism commonly slows down the gut motility and leading to constipation. So in this scenario, if there is a thyroidism is causing constipation, getting this test done can help identify these root causes. So always ask your doctor and discuss with your doctor to test these if you think hypothyroidism or is the causing your constipation. Now let's move on to another test, 10, serum potassium level. The purpose is to diagnose hypokalemia, a condition with low potassium levels affecting bowel movements. Potassium is essential for normal muscle function, including the muscles of the digestive tract. Low potassium levels, hypokalemia, can impair muscle contractions in the intestines, leading to constipation. A serum potassium test measures the amount of potassium in the blood. Obviously, a blood sample is taken in the lab and analyzed to determine the potassium levels. So, low potassium level, hypokalemia, can cause weakened muscle contractions, including in the intestines, that leads to constipation. And high potassium, hyperkalemia, which is less commonly related to constipation but can cause muscle weakness and fatigue, potentially impacting overall health. So, low potassium level can cause weak muscle contractions. And obviously, muscle contractions are important for sterilisis and pass the stool in the from the large intestines to rectum. So if you think your potassium level is causing it, please consult your doctor and get this test done. Now, number 11 is serum calcium level. This also detects hypocalcemia, where elevated calcium levels can cause to constipation. And obviously, calcium is a vital for various bodily functions, like potassium for muscle contraction. And the elevated calcium levels, hypercalcemia, can reduce gut motility, which causes constipation. A serum calcium test measures the amount of calcium in the blood. Similarly, it's a blood test, and the low level hypocalcemia, not commonly linked to constipation, but can cause muscle spasms and cramps. And high calcium, hypercalcemia, leads to reduced gut motility and constipation due to increased muscle relaxations. So these things can cause potassium, and both calcium, potassium low levels and calcium high levels can cause gut motility and lead to constipation. Now let's talk about 12, serum osmolality and urine specific gravity. The purpose is to diagnose diabetes insipidus by evaluating low urine specific gravity and high serum osmolality. So, diabetes insipidus affects the body's ability to regulate fluid balance, leading to excessive thirst and urination, which can impact bowel movements. So, serum osmolality test measures the concentration of particles in the blood, and urine specific gravity test measures the concentration of particles in the urine. For serum osmolality, a blood sample is taken, while for urine specific gravity, a urine sample is collected. So, low urine specific gravity and high serum osmolality, which is diabetes insipidus, leads to dehydration, which can cause constipation. As we talked earlier as well, when there is body is dehydrated, the intestines pull the water from the stool and making the stool harder and making it difficult to pass through the large intestine. So dehydration can be caused by diabetes insipidus, which can relate to constipation. So if you think your diabetes insipidus is causing your constipation, you can ask and discuss about this test with your doctor. So another test we are going to talk about is blood glucose level, which is number 13, blood glucose levels and HbA1c. This purpose is to diagnose diabetes mellitus by evaluating the blood sugar levels. So high blood sugar levels, hyperglycemia can lead to nerve damage and reduce gut motility, causing constipation. So two tests, blood glucose test measures the current level of glucose in the blood, and HbA1c test measures the average blood glucose levels over the past 2-3 months. So blood glucose level, a blood sample is taken, even for HbA1c, a blood sample is taken to measure the percentage of hemoglobin coated with sugar. And for blood glucose test is often after fasting. So there are two, fasting and after fasting. So impact of levels and constipation is low blood glucose level, hypoglycemia is generally not linked to constipation, but can cause generally weakness and fatigue, while high blood glucose, hyperglycemia, can lead to neuropathy, nerve damage affecting the intestines, and slowing down the gut motility, which results in constipation. Again, even think diabetes mellitus is causing your constipation, request or discuss with your doctor to get this test done. Next, number 14 is vitamin D intoxication test. So, which again, low vitamin D and high vitamin D can impact the constipation. And here is how. So, low vitamin D can cause an inflammation, so that can also cause constipation, whereas excessive vitamin D can lead to hypercalcemia, which can in turn cause constipation. So in order to test this, our serum 25 hyperoxyvitamin D measures the amount of vitamin D in the blood. Again, the blood sample is taken, and low levels, I said earlier, is often linked to poor muscle function and gut inflammation, which can contribute to constipation. And high vitamin D levels leads to hypercalcemia, causing reduced gut motility and constipation. So both high and low both can cause constipation. And vitamin D deficiency is quite common around the world. Uh, the reason behind that is most of us are indoors all the time. We don't go out much, and the major source of vitamin D is the sun. Therefore, we are not getting enough sun. Especially, there is more risk to people who live in the northern or who is close to northern poles or southern poles, because of sun rays. There isn't enough ultraviolet rays that reach that part of the region, and vitamin D is deficient for most people. For example, I live in New England area where winters are longer, and I do not get enough vitamin D through sun because it's short summer and long winter. I mean, in summer it's extremely hot, so we rarely go out. Then how do I make sure that I have sufficient vitamin D? So there are two sources. Obviously, food, and food such as milk or salmon and so on can get some vitamin D, but generally insufficient. So what I resort on is taking a vitamin D supplement. And that's where, while taking the vitamin D supplement, we have to be careful because excessive vitamin D or excessive vitamin D intoxication, as I said earlier, can lead to hypercalcemia, which can cause constipation. So always it's better to and monitor. So it doesn't have to be that frequent, maybe annually and so on. We can measure it. And if you think vitamin D deficiency is causing constipation, you can always request to get tested. It doesn't even have to be done by gastroenterologist. I think you can discuss that with your general practitioner and get this tested. I got tested. I had low vitamin D and started taking vitamin D supplements. After that, I did multiple things, but getting the right vitamin D level also contributed in giving me relief from chronic constipation. Now let's talk about the last one in this segment, which is lead blood level test. So lead blood level test detects the lead poisoning, which can cause constipation. Obviously, lead poisoning can affect multiple bodily systems, including the gastrointestinal tract, leading to symptoms like abdominal pain and constipation. And a lead blood level test measures the amount of lead in the blood. And obviously, it's done in the lab. The blood sample is taken, And a low, so impact of levels on constipation. Low lead levels, normal levels do not impact constipation, while high lead levels, lead poisoning, can cause gastrointestinal symptoms, including abdominal pain and constipation. So these are the tests that we talk about in the basic metabolic and endocrine assessment. Thyroid function test, serum potassium levels, serum calcium levels, serum osmolality and urine specific gravity, blood glucose levels, HbA1c, vitamin D intoxication level, and lead blood level test. Again, it's important to know that this is for information purposes only, and I think for personalized advice and personalized treatment plans and personalized root causes, it's important to discuss these tests with your doctor. And if a doctor is not prescribing, perhaps being proactive and advocating for their own health and listing these tests and getting this test done, because most of these tests are fairly inexpensive and compared to the other very invasive procedures. So I think ruling out these endocrine and metabolic causes would be really beneficial, either to hone in, pinpoint the root cause, or rule out the possible causes of these. So always consult this with your doctor. And next, we have completed the basic test, which can be either done by the gastroenterologist or primary care doctor, or even there is a referral for the psychological assessment to psychologist or psychiatrist. And now let's move on to the more advanced diagnostic test, which will be run by or prescribed by gastroenterologist.